Welcome everybody, welcome to Lecture 18. Today, there's quite a bit to get through. I'm going to introduce the third type of coordination. And I'll skip straight over the outline for you to look in your own time, and I'm going to start on this slide. So in the last 5 lectures, I've talked a lot about responsible government and the chain of accountability. And everything we've covered so far in this module is based on this idea that governments have the right and the power to govern, and that means what they say goes when it comes to implementation. But what if that story about how policy is implemented and how government works is actually a bit of a myth, a mirage? What if it's just wishful thinking? What if government actually works in quite a different way? So remember back in Module 1, we showed how policy decision-making processes involve multiple actors, and policy decisions are often the product of bargaining and compromise. Now, what this tells us is that governments may have authority, but they don't necessarily have sufficient power. And that same point applies to implementation. So the ways we have of coordinating implementation based on traditional public administration or new public management often don't work in the way that they are supposed to. Relying on authority often does not lead to effective implementation. And this happens especially when there are other policy actors involved in implementation and where those policy actors have power. So remember that government knowledge is also limited, and other policy actors may know things that governments don't. So in today's lecture, I'll introduce you to another way of thinking about governing, one which has become very prominent in public policy theory and practice over the last 30 years. And it's based on looking at how things actually do get done sometimes, rather than how things are supposed to get done according to the doctrines of responsible government. Time for our next slide. So the key term to introduce here is governance. And if you look at that word, it is similar to government, but not the same. Both words are derived from the Greek word kubernan, K-U-B-E-R-N-A-N, which means to steer. But governance has a different meaning. It refers to the process of how a range of policy actors, each drawing on different and distinct sources of power and expertise, collectively steer policy. So in governance, government agencies are simply one type of policy actor, more or less on an equal footing with non-government organisations. And government actors are part of the process, but not in control of it. So some of the key theorists of governance, Mark Bevier and Rod Rhodes, use the phrase decentered governance, by which they mean that in practice there really isn't a central source of authority and power, but instead there are many sources. So the COVID-19 vaccination rollout illustrates this quite well in a way. So from a distance, it looks as if the government has centrally coordinated the vaccine rollout, primarily through DHBs. And this has been somewhat effective in reaching a lot of people, but 3 to 4 weeks ago, it became really clear that this approach was not effective at reaching Maori and Pacific communities. To be blunt, government agencies simply did not know how to do this effectively, even when they thought they might know. But Maori and Pacific health providers did have many good ideas about how to do it, and many of those, such as the ShopBro buses, have become part of the rollout in the last week or two, starting to reduce the inequities in the vaccination rollout. But what this story reveals is the myth of responsible government and accountability, which is based on the assumption that governments know what they want and they know how to do it before it is done. So the reality of the vaccine rollout is that many organisations have worked together to get the job done, and the relationships between them are not based on hierarchy or principal agent theory, but based on relationships of mutual recognition and partnership, and working out how to do something while you are doing it, not before. Now, this story is common in health, and it's common in many other policy domains, and it shows that there is a type of coordination that is involved here, which is very different to both hierarchy and market. Now, this type has a number of labels, but there are three words that are common or part of all these labels. And those words are networks, collaboration, and governance, which we've already covered. So you might read about network governance or collaborative governance or collaborative networks. They're all talking about the same thing. So we are going to use the term networks because that's often used as an alternative to hierarchies and markets. So what does network coordination involve? Well, at its core, it's the idea that multiple actors, generally three or more, develop cooperative or collaborative approaches to addressing a common problem or situation. Now, the relationships between these organisations are heterarchical. Okay, the fancy word which means that they are on an equal footing with each other rather than in hierarchical relationships. Okay. Now, in hierarchical coordination, one party tells the other what to do. It's a one-way relationship. And in networks, the relationship is based on two-way dialogue. Now, there is a two-way element to market coordination, of course. We covered that. There is negotiation over price and quantity and quality, those sorts of things. But in networks, the negotiation and the dialogue is about a much broader range of things. It's about what to do, about how to solve problems, how to address a particular problem. Now, to do this, different members of the network draw on their particular knowledge, their particular experience, and their organisational resources. So to recall an earlier lecture, this is the Miles Davis way of making music. Remember that example? It was these were the cream of jazz musicians, and Miles Davis just simply gave them very simple instructions, or not even instructions, but just said, "Okay, let's create something together. Let's co-create." So have a listen to "Kind of Blue" if you've never heard it before, and you'll see the results of that. So to work together this way, there needs to be some trust between members of the network, particularly when each member agrees to do a particular thing, they are true to their word. So let's see how these characteristics apply to a real life network in the health sector. So back in 2011, many health organisations in the Auckland region recognised that there was a big problem in accessibility of medical care on evenings and weekends. Okay, so your child might have a fever. It's 8 o'clock in the evening. You could go to an accident and medical clinic, an A&M or an after-hours clinic they're called. But it would probably cost you over $90. And many people with urgent health needs simply can't afford that, so they would end up at the hospital emergency department, which is already under stress. So to address this problem, the 3 Auckland DHBs, the 7 primary health organisations, and multiple accident and medical clinics got together and formed a network. This was called the Auckland Regional After Hours Network, and across this range of organisations, there were very different values, different interests, different perspectives regarding the cause of the problem. So those perspectives varied from, are GPs not meeting their contractual responsibilities? Is the problem due to workforce shortages and the high price of labour? Is it that DHBs are not funding primary care sufficiently? Is it because the A&Ms are price gouging? Now, from 2011 to 2015, ARAN, the Auckland Regional After Hours Network, was a forum in which these organisations regularly met and interacted in order to develop and implement a solution, which was to pool financial resources in order to subsidise the cost of after-hours clinic visits for targeted groups such as children under 6, or the elderly, or people living in deprivation 9 and 10 areas. Now, the key to making this work was that members of ARAN were equal partners. The DHBs weren't the boss of the PHOs, for example. Now, coming to a solution wasn't easy. There was lots of bargaining, lots of compromise in order to get the deal done. Different organisations drew on their different types of knowledge, such as the pressure on emergency departments, the cost of A&Ms employing local doctors when there was a workforce shortage, PHOs knowing that their member primary care practices didn't want to lose their enrolled patients to accident and medical clinics, for example. So this is not all sweetness and light. Now, in the next slide, I'm going to talk about different types of networks. So there's lots of examples of networks in health policy. They vary quite a bit. And one thing that varies quite a bit is the degree of trust and collaboration between members. So at one end of the spectrum, according to Mandel and Keast, who you're going to read next, at one end of the spectrum are cooperative networks. Those are organisations which don't interact with each other on most things, but might occasionally, for example, share some information. So perhaps two social service organisations have a particular client in common and they just need to understand what each other is doing. Now, in the middle of the spectrum are coordinative networks, and ARAN is a good example of this type. This is where members come together to address a specific problem, such as the inaccessibility of after-hours care in Auckland. Now, at the right end of the spectrum are collaborative networks in which members constantly work together on a wide range of issues and problems. And as a result of doing this, they develop a distinct and collective identity. And the best example we have currently in Aotearoa is the Canterbury Clinical Network, which is often touted internationally as a shining example of what health systems need to look like. So the Canterbury Clinical Network developed in order to create a more integrated approach to health service provision in Christchurch. And that meant that the DHB, the PHOs, and the non-government providers were constantly interacting over nearly every aspect of health service delivery. So all members were committed to the collective identity of the CCN and emphasised that Canterbury had an integrated health system, one budget, rather than multiple organisations and siloed responsibilities and funding. So they developed networks, lots and lots of smaller networks across for each different service areas. These were called the service level alliance teams. So Canterbury was a great example of collaborative networks. So now I want to throw another term at you. Okay, we're going to add to the word governance and stick public in front of it, and then stick new in front of that. And we get new public governance, which is a contrast, if you like, to new public management. So the leaders that created the Canterbury Clinical Network and many other advocates of network coordination claim that a health system that operates in terms of new public management principles of institutionalised distrust, transactional or arm's length accountability relationships between organisations. I would argue that this is not the type of health system that we need. And there's across a whole range of policy areas, there's similar arguments. So this has led to some of those academics to develop an alternative model or paradigm of how government and how public policy implementation and service delivery should work. And this is known as new public governance, and its key theorist is someone called Stephen Osborne. And that's a different Osborne to the Osborne in the government should steer and not row phrase, which is so central to new public management. Now, we can think of new public governance, NPG, as something that's founded, absolutely rooted in collaborative networks. So NPG is similar to NPM in that it highlights the importance of non-government organisations in policy implementation. So in NPM, you remember, non-government organisations are the agents that agree through contracts to do the things that the principal, government agency, wants. But those private organisations don't have a role in deciding what is to be done. But NPG, New Public Governance, goes much further in that the non-government organisations also take on a significant role in policy formulation as well. So they are involved at the get-go in helping decide and design what is to be done. So an NPG approach to the COVID vaccination rollout would involve building in Māori providers, Pacific providers, PHOs, pharmacies, as well as DHBs in the design of the rollout right at the beginning. Okay, so talked about networks, and they're an alternative to hierarchy in markets. And we've had a few decades of experience with real networks, such as the Canterbury Clinical Network or ARAN, or many others in many other countries and many other sectors. So there's quite a bit of scholarship around about the circumstances in which networks could lead to more effective public policy. So clearly, we've already established this. Networks are worth considering when hierarchical and market mechanisms don't work that well or have negative consequences, such as all the things we covered in the previous lecture, such as service fragmentation or high transaction costs or institutionalized distrust. Now, we can also go back to Module 1, and let me just find my cursor. We can go back to Module 1, and you remember the reading by Klein and Coppenjan, the typology of policy problems, that also came from Robert Hopper. So in the book that reading is taken from, the authors argue that networks are applicable to a lot of policy problems, particularly those that are not highly structured. So that is where there is some disagreement about either ends or means. Those are the policy problems where networks come into their own. So, as in the Auckland After Hours example, a successful network doesn't mean that members have to agree about what the problem is or what values are important. All that's needed is that there is agreement eventually about what to do. Right, so that way, whatever is decided has the buy-in of all the key interests, all the key organisations, the key stakeholders, when it comes to implementation. And that is one way of dealing with disagreement and conflict, is to get everybody to agree to do something, maybe for different reasons. Okay, so networks is about getting, there's a phrase in management literature which talks about getting to yes, if you like. Next up, I've emphasised the role of non-government organisations, private organisations in inter-organisational networks, but you can have networks of government agencies as well, particularly in situations that we discussed earlier where the different government organisations are not connected in some sort of chain of accountability. So this is relevant to a wide range of issues that are intersectoral. Okay, they cross boundaries of health, education, transport, etc. So one example is antimicrobial resistance and what to do about it. Okay, a fancy name for superbugs. Okay, bacteria that have developed resistance to antibiotics. Now, this is a policy issue that covers health and primary industry and some other areas as well, because primary industry is important because antibiotic use is prevalent in the production of meat, particularly chicken meat, poultry. Okay, so a solution to reduce antibiotic use needs to involve the agriculture sector as well, and the primary Ministry of Primary Industries is important there. So usually in these sorts of organisation networks, a particular government agency might be given the lead role, the coordinator role. Or sometimes a new entity is set up to steer the network itself. Okay, so you'll come across this sort of language when you're looking at many areas of government policy. Right. Okay, so this gives an indication that governments have cottoned on to the idea since the 1990s that network coordination can actually lead to more effective policy implementation and governance. So, for example, in the health sector, the Ministry of Health required DHBs and PHOs across the whole country to form interorganisational networks in their local area. And these networks were to be known as district alliances. You may have come across them already. And this idea was modelled directly on the Canterbury Clinical Network, which had developed in the mid-2000s. Now, this raises an interesting question about how networks get going in the first place. So in Canterbury, they got going because the key leaders of the DHB and the PHO, the various organisations, saw that networking and collaboration was a good idea and could help them achieve a common goal. And in Canterbury's case, this common goal was a more integrated whole system of healthcare. Now, so we could call that a self-organising network. A second origin story, if you like, there may be a particular organisation or key person from an organisation who sees the potential for network collaboration to solve a particular problem, and that person or that organisation works proactively to bring other organisations into a network. And this was the origin of the Auckland Regional After Hours Network. It was the chairperson of one PHO who was a real broker who brought together the many stakeholders. And finally, sometimes what you get is governments deciding that there are going to be networks. So the requirement to form district alliances is an example of this. These are called mandated networks. Now that could be a bit of an oxymoron, a bit of a self-contradicting term. So mandated networks are a bit like getting kids in the playground who aren't necessarily friends to play nicely together and cooperate. Now sometimes that works, often it doesn't. Okay, so we are going to pick up on some of the downsides of network in the following lecture. But as a final comment today, the whole thrust of network coordination and new public governance is to emphasise collaboration as the key to successful policy implementation rather than accountability. So in our next episode, we'll look at some implications of this and we'll explore what it really takes to get networks happening. We'll explore the downsides of network coordination, and we'll also explore what happens when you have more than one type of coordination happening in the same place at the same time. Till then, ngā mihi, haere rā.